Antidepressants and implants, more scientific links coming up. Hi, I'm Allie Cook. Today's March 16th, 2016, and this is your Wednesday Watch. Here's today's dental news. A new study has found that antidepressants are linked to tooth implant failure. As the second most prescribed drug in America, this may be important news for many of your implant patients. Researchers at the University of Buffalo found that this type of medication may weaken bone growth, which is, of course, a crucial factor for implant success. Use of antidepressants increased the odds of implant failure by 4 times with each year of use, doubling the odds of failure. The CDC reports that antidepressant use has surged 400% between the periods of 1988 to 1994 and from 2005 to 2008. This week's special guest is March author and expert in endodontics, Dr. John West. Dr. West, tell us about your article in this month's issue of Dentistry Today.
Thanks, Allie. I love writing for Dentistry Today. I even love it more when they accept the articles. Well, I wrote about something that's important to me, and it's important to anybody doing endodontics, and the subject of my March article is the 3 F's of endodontics, and it's really a roadmap of how to do it step by step. And the first F, do you know what they are? Well, the first F has to do with finding the canal, so that's the first F, and it gives a dozen hints on how to do that. And then the second skill, which is the really unheralded skill in endodontics, is how to follow the canal. It's a lost art, really. And so there's some guidelines of how to follow the canal from the top to the bottom. Then the rest is really easy with the nickel titanium instruments of today. That has to do with finishing, which has 4 parts: shaping, cleaning, cone fit, and then obturation. And so if you read the article, you'll do better endo.
Thanks, Dr. West. And to our viewers, remember you can pick up Dentistry Today in print or online in our digital edition. Coming up, baby tooth donors are being sought out. Could you be one of them? A special story for our viewers from St. Louis. 300,000 baby teeth that were collected from donors in the St. Louis area some 50 years ago have been studied and analyzed, but researchers may need your help. They're trying to recontact the people who originally donated the teeth and see what their health status is today. The main goal is to see what impact radiation exposure 50 years ago may have had on the health of these children as they have now grown up into their 50s. Letters have been sent to 1,000 local participants, and approximately 400 have agreed to take part in a follow-up study. If you think you may be one of the donors, contact the Washington University School of Medicine in St. Louis. Thanks for checking out the Wednesday Watch. Stay tuned next week for more from Dentistry Today and DNN.